going to be your student physical therapist assistant this afternoon. Okay? So it looks like you're in because you're having some weakness to your right tricep from a car accident you had about 10 and a half weeks ago or so. Okay. So, are you having any pain currently? No pain. Okay. What about any weakness? Are you feeling weakness? Where about? Down your whole. Okay. And so, are you having what type of limitations in your activities of daily living are you noticing, if any?
It's hard to lift things and correct things. Like anything that I'll have to pick up in this motion.
Okay. And then are you on any type of, are you taking anything for pain or like a muscle relaxer or anything to help with? No? Okay. Okay, and then I see your long-term goal is you're trying to strengthen your triceps so that you can return to work as a pipe fitter without restriction in the next 4 weeks. Okay, so that's what we're going to focus on. We're going to try to get you back there. So I'm going to briefly explain how electrical stimulation works and what you should feel from the treatment. But before we get started with that, I do have to clear some contraindications just to make sure the treatment is going to be safe for you, okay? So I'm going to ask you a series of questions and you can just yes or no, okay?
Okay.
Do you have a history of cancer within the last 5 years?
No.
Any any heart conditions?
No.
Okay. Any hypertension or hypotension, so high or low blood pressure?
No.
Any skin conditions or skin allergies? What kind of skin condition do you have?
Eczema.
Okay. Are you currently having like a breakout right now?
No.
Okay. Any sensory loss? So are you able to distinguish hot from cold? Like,
Yeah, I can do it.
okay. Any history of blood clots or circulation problems?
No.
Are you on a blood thinner or do you have a history of excessive bleeding?
No.
Okay. Do you have on any lotions, oils, or like topical medical agents like Bengay or anything like that? Any recent infection? And do you have any piercings, like body piercings or electrical implants like pacemaker or anything? Okay, so basically what this procedure is called electrical muscular stimulation, and it can be used for different things, but today we're going to use it to elicit a muscle contraction to help to strengthen those tricep muscles so that you're able to do the elbow extension. Okay, basically we're going to go through a series of sensations. So the first sensation that you might feel is like a tingling sensation, and then you may feel a little more of an intense twitch, like an intense tingling. So we're going to go through a sensory level, a twitch level, but ultimately we want to get to a full muscle contraction, because that's what's going to actually take your muscle through the motion and stimulate taking your muscle through that motion and increase strength in that particular muscle. So in order to do that, I have to place these electrodes on your tricep muscles and set the parameters on here, which I've already set. So my parameters I have set for electrical muscle stimulation, synchronous it automatically set it for 60 minutes. And then I'm doing 200 pulse duration for comfort, 20 to 35 frequency, starting at 20 because triceps are a smaller muscle group. With a ramp time of 2 seconds to elicit a smooth muscle contraction, and a duty cycle of 1 to 3, 4 seconds on, 12 seconds off or relaxed. Okay. So I'm gonna place the electrodes on, and then I'm gonna actually probably have you stand so that we can place your, well, actually it might work like that. I just want your muscle on a slight stretch. Are you able to slide on this pretty good with your hand slide on? Okay. So and I'm placing the electrodes on. I'm using the 2x2s because they're the smaller electrode size for a smaller muscle group. I'm placing the black electrode on